Good morning, and welcome to the Red Cross Branch Nevis, and welcome to this sports education session with our featured guest, Dr. Patrick Martin. The Red Cross is very pleased this morning to partner with the Ministry of Education, the Ministry, and the Ministry of Sports. And it is indeed a pleasure to see so many sports officers and sports coaches here this morning. As we are aware, I think sports in Nevis and the athletic season, or the sporting season as we call it, is enthusiastically looked forward to every year. I think even more so than our Culturama and Carnival. Sports, the various school sports, the competition, the enthusiasm from parents, from school, and from the general public is a fact here in St. Kitts and Nevis. It's something that everyone looks forward to every year around this time. And we thought it important because as Red Cross, we are the primary first responders supporting Ministry of Health and Education. And through the years, there's been incidences, and there will continue to be. As long as the human body is moving, things will happen to it, mostly good, but unfortunately, sometimes things not so favorable happen, and some of those events happen during the sporting events. And we thought it important to get a scientific team approach together to discuss with you, the coaches, on how you can best prepare your athletes, because the sport starts long before the actual field event. And preparing your athletes is key. And so that's the reason for us being here this morning. And so to make it very short, I would now like to introduce our key speaker. Ideally, he actually needs no introduction, but I'm required to. His name is Dr. Patrick Martin. He wears so many hats, but I'll just mention two of them. He's currently the special advisor in the Ministry of Health in the St. Kitts Nevis Island Administration, and he's a family physician. But most importantly, he is a pediatrician. And I said that with some pride on his behalf, just to give a little nugget of Dr. Martin. And I'm going to say something you probably don't even remember. Some of the key things I've learned as a nurse through my years, and I've had the opportunity to work many places, was as a student nurse with Dr. Martin way back in the early 90s. He's one of the first persons I learned that coconut water can be used and infused. You remember saying that, Dr. Martin? That coconut water, apart from water, is one of the most effective, efficient infusions in either oral or systemic for hydration. And he is passionate. He's a sports person. Although he's a physician, I think he loves sports as much as he loves medicine. But above all, he's everything pro-children and pro-adolescents. He's very passionate about youth and everything youth, and especially in the area of sports. So without further ado, I turn you over to Dr. Martin, a very efficient presenter.
Thank you very much. Good morning. Thank you for joining us, ladies and gentlemen. I understand all of you are involved in the care of young athletes. Notice the title of the presentation. It says care, not medical care. It's education care, family care, medical care, athletic care of young athletes. I intend to allow a lot of time for interaction, because it's during interaction that we get the most out of it. So I have some stuff in my head, and I need to get it out of my head, so at least one of you may soon replace me at the podium, because as you can tell from my gray hair, I am about 35 US. Thanks to the Ministry of Education, Ministry of Sports, and the Nevis branch of the Red Cross for facilitating. And I'm available to you individually. You just call Roxanne and we can work it out. So why are we here? Well, It's the most wonderful time of the year in Nevis sports. Can I get an amen, somebody? I think we need a break from the politics. Can I get an amen, somebody? Kamali Newton has reaffirmed that Nevis has sporting talent. 10.73 in late January, early February. Smells like 10.43 by Carifta Games in April, once he stays healthy. Talent has to be guided, and coaches have to know the fundamentals of child development and sports science. This is just an appetizer. There's another reason why I'm here. Last night, when I had nothing to do, I was watching a road relay done by our good friends at the Nevis GIS. And I saw an athlete running a road relay, a section of a road relay with an inhaler in hand, which suggests that his asthma was not in control, which means that he should not have been competing. Sports performance, like life, there are no shortcuts to glory. The knowledge I have in my head, I got it from other people, specifically during my training, pediatric training at Jackson Memorial Hospital in Miami. That's where I started pediatrics and also sports medicine. And then later, I had the opportunity to get some training with FIFA and the Olympic Committee, etc. So a physician is a teacher. If we don't teach, we are a fraud. So all energy comes from the sun. The human body needs, this is revision, the human body needs continuous energy to function. Physical activity and thinking, schoolwork, all of those increase the demand for energy, but physical activity increases the risk of injury, especially when the physical activity is not supervised. So young athletes, children and adolescents are developing. They're not small adults. They are not small adults. They are in their own right, children and teenagers. Resistance training can be done. When I was younger, we were told to stay away from resistance training in children, but the research has now concluded that resistance training can be done, but adult techniques cannot apply to children, to young athletes, and persons caring for young athletes must be guided by science and evidence. So my presentation flow, 5 sections. It's going to take about half an hour, 45 minutes tops, and then we'll have Q&A. How to improve strength, endurance, flexibility. You already know some of this. I'm going to add from a medical standpoint, and we'll see how both jive. So training techniques. How does the body produce energy for specific track and field events? That's the energy systems section. What's the best energy diet for young athletes in Nevis? That's the energy nutrient section. What is the best sports drink? Well, my friend Roxanne has already taken care of that. That's the hydration session, and then some injury management tips. You ready? So if you thought you got away from physics in high school, here we go again, physics. So energy is the capacity to do work, mental work, physical work. Power is equal to work divided by time, how much work you can do over time. Work is force times distance, and force is mass times acceleration. Putting it all together, power is equal to mass times acceleration times distance divided by time. Let's do a graphic on that. So on your left, that's the Nevis Athletic Track. On your right is E.T. Willett Park. Remember those days? So the athletes on your left are at a standstill. The athletes at your right are taking off. So how do you get from standstill to taking off? That's acceleration. They have to move their body mass from 0 meters per second to take off. It's acceleration. And through all of that, they go a certain distance. And if they make the time during heats, they get a standard point. And if they do this with the least amount of time, they win if you're doing track events. So this slide is to reaffirm that this is science, and as science evolves, changes sometimes, and we have to stay current. So some more power work. That young lady is having an extreme extension of the lower spine, which I don't recommend squats with weights in adolescents at all. The two children at the bottom are doing some bounding exercises on an artificial surface, which means that all of the reaction forces from the ground is transferred back into the body. And if they don't have strong muscles, the joints will pick up the load, and joints are not designed to pick up that load, and so they're going to get strains. We're going to come back to that. So, guidance in training techniques. That's a burst pipe, that's a rough uncut stone, and that's a diamond. What's the point, Doc? Pressure can burst a pipe, and pressure can make a diamond. It's how you apply the pressure, how and where and to whom. Too many children in Nevis have had their pipes burst by the pressure of competing in athletics. True or false? Good. We can now move on. Training has to be youth-centered. Youth-centered means you're focusing on the young people, not on what the teachers want, not on what their parents want, per se, or not what the community wants, but it's on the young people. It's about the fitness mindset. It's about developing mind and body. Healthy diet, because involvement in sports can incentivize them to eat a healthy diet, continue taking part in beneficial exercise, getting their rest, having fun. Why? Because in St. Kitts and Nevis right now, 1 out of 3 children are either overweight or obese, meaning fat, which means that now and into the near future, we're going to have higher rates of diabetes and cancer in teenagers and adults. Psychology affects performance. Involvement in sports is about individual and team resilience, meaning toughness, but more so how you can bounce back from a defeat or a loss. At youth and junior sports stages, this thing about no pain, no gain is nonsense. If they have pain, you have to stop and refer. No pain, no gain, that applies may apply to seniors, but not to juniors and youth. Right? Youth-centeredness also means control of overly aggressive parents, guardians, and teachers. Here's a tip for you. Consider organizing awareness talks by professionals to your PTA, community center, radio, and television, because some people think that children are small adults and they must be treated that way. On the training ground, if somebody is interfering with your training, you pull them aside quietly but firmly say to them to cease and desist. If they continue interfering, or if they appear to be overly aggressive, you might have to step it up to child protection. It's strongly recommended that the children have a pre-participation physical assessment that will uncover those who have asthma, epilepsy, straining to pass stool, therefore at risk for hernias, and those who have pre-existing injuries, because you don't want to start a training program and you don't know this stuff. Because if something happens, heaven forbid, you will be blamed. Train on grass and sand, compete on track. I noticed there's a belief that an artificial surface is going to make you better. That's not true. Artificial surfaces are harder than grass and sand. Grass and sand absorb the shock. Train on grass and sand, compete on the track. And that will reduce the risk of injuries, especially stress fractures and tendonitis. I'll get back to that. All injuries should be certified as recovered by a medical practitioner before returning to training. It's not the doctor say I could come back, you have to see a paper. I recommend that to you. To your association, you have to see a paper. Because, doctors are strange people. You are not dead unless a doctor certifies you are dead. It's called a death certificate. The law says that. So we have certain responsibilities in our writing. So if I write back to you and say, Coach, this child is ready to return, then that is my assessment to you. If it is wrong, then it is on me, not you. So protect yourself. Rest and recovery time, mandatory. Here's a youth-centered training schedule. It is my view, strong view, that at preschool, kindergarten, and grade 1, it's all about fun and togetherness, not competition, not medals. Everybody should get a button, something. Even the child who crawls in after an hour on 100 meter should get a something. It's about their participation. But from grade 2 up to grade 6, you can start getting into some organized schedule, but it must be a multi-dimensional schedule, event-specific exercises twice a week, but in between there you put in some rounders, some cricket, some football, some swimming, or whatever to keep it fun. In other words, and day 6 and 7 rest. In other words, these are not elite athletes working out every day. Even elite athletes have breaks in between for rest and recovery. If they look like adults, they can train like adults. I'm going to get back to that. Resistance training does lead to gains in strength, endurance, and flexibility. These exercises involve pushing or pulling against a resistance. But at youth stage, we tend to favor the resistance, meaning your own body weight. Lately, there's been some research that is saying that at youth level, you could use some barbells. I'm going to get back to that. Again, must be supervised. So there are courses in resistance training for children, and I believe the International Committee for the Red Cross will be happy to hear from us, because they could provide some training. You have to know the specific physical and psychosocial uniqueness of young people. You have to know the principles of resistance training and correct movements, correct and safe movements. Here's what's happening in Nevis right now, and in St. Kitts too. In open events, well, in grade 6, sorry, let me back up. This is the Tanner scale of youth development. Children, this is a child, an adolescent with adult characteristics, usually by age 16, 17, most adolescents are showing adult physical characteristics, not psychological, physical characteristics. But you have some kids, you have some children in grade 6 who are Tanner scale 3, and you have some children in grade 6 who haven't started their development yet, but yet 1 and 3 are in the same open event. So naturally, the child who is stage 3 is going to win, because they have more development, more muscle mass, more power. Naturally, even if they don't train. So yes, part of the assessment of children, boys, is to drop their pants and to do the assessment that's to their state of development. And to the girls, where the fellas could drop their pants on the open field, the girls, you take them into a room and a female coach does the assessment. So once again, I'm available to assist you with that. Or pediatricians, the 2 pediatricians, or doctors at the hospital can help you to go through this. All right, so again, the training must have a purpose, The child must know the purpose, the guardians and the parents must know the purpose of the training. We focus on the individual child. Some children have more starting skills than others. And of course, some children have been physically active since age 2, so they have a longer training age than somebody who starts at age 10. So all those things we keep in mind. Another thing to keep in mind is that children have a greater surface area to body mass than adults, so children absorb heat from the atmosphere, absorb more heat from the atmosphere than adults, so children overheat faster. So we can't train the children like adults because they overheat faster. So the peak heat is 11 to 3. So 11 to 3 training, we have to be careful about that. I'm going to get back to that. Mandatory drinks breaks, especially when the place is hot. Oh, we're having some cool breeze right now. That's very nice. Water, coconut water, no commercial sports drinks for children. None. Zero. Zilch. They're not ready for that. The commercial sports drinks, well, Gatorade was the first one developed for the Florida Gators. That's Gatorade. All right? It was scientifically developed for American football. None of our children are involved in American football types of training and performance. And so Nevis water. Now, you remember the days when we drank water from a water pipe? Now, if you don't have it in a bottle, people are not interested, right? You see how to make money? You make money by packaging something. You know, packaging. The Americans taught me that. You could put drain water in a bottle, put a package label on it, and people will buy it. It's too serious. It's supposed to be a joke. All right. Training in shade, especially the hotter months of the year. Find some good shade or a place that has good cross breeze. Cross breeze. Breeze blowing straight in your face. That's a lot of resistance. Cross breeze will help with the cooling. There must be a water pipe and a hose for sprinkling, just in case. One of the best ways to cool an athlete down is to have a bottle like that, put a little thing on it, squirt them down. You look professional when you do that, Just like you look professional when you have your spray. Well, a spray is just ice in a can. But with the spray, you look sophisticated, right? So, light clothing. It has been shown in children, resistance training lasting more than 23 weeks. That's 6 months. You will see you get to peak strength. But strength starts increasing after 8 weeks. So actually, training for the athletic season is supposed to start before Christmas. And frequency of 2 to 3 times per week. Even if they stop training, you can still have the effects of the training if you stop for 8 to 12 weeks without training. I mean, you personally have noticed that. You stop training, for Christmas and Carnival and Culturama, and you go back on, you still feel good, right? So the research has shown that if you're well trained and you stop for about 4, 8, 12 weeks, you'll pick back up very quickly. That's the importance of rest. So again, all of this, by the way, I circulated a handout, I hope you got it, so all of that is in there. Look at this, exercise involving the core, abs, lower back, your gluteal muscles, that's the core is the part of the body that really sets you up, keep everything tight and compact for posture. And all of this is in your handout. And so I'll just go quickly to here. This is a website from Australia. So look at that, ages 6 to 9, training guidelines, light resistance, push-ups. From 9 to 12, body weight, and some barbells. 10 to 15 RPMs, not RPMs, RMs, meaning 10 RM means the heaviest weight you can lift for 10 consecutive reps. By 12 to 15, body weight, a little bit more sophisticated free weights, 8 to 15 RMs, but avoid complex movements unless you are certified in that. And by 18, you're training like an adult. Some 17-year-olds too. You know, they are as strong as adults. Now, let's move to section B. After section B, I'm going to stop and ask if you have any questions. How does the body produce energy for specific events? Well, let's get this point clear again. All energy comes from the sun. Everything else is bull. That product there is actually caffeine. 2 cups of coffee, the amount of caffeine in 2 cups of coffee is in that. Caffeine increases your heart rate, increases your blood pressure. So that puts you at risk for heart attack, stroke. So the energy from the sun is converted to food. Remember this from high school biology? Photosynthesis. Yeah. Your teacher was speaking about the energy chain from the sun, chlorophyll in the plants, pick up the sun's energy and converts it to chemical energy in food. We eat plants, we eat the animals that eat the plants, and so there's a chain from the sun, God's sun, to our plate. In human cells, the energy carrier is a compound called ATP, adenosine triphosphate. And adenosine triphosphate is produced by 4 energy systems. Energy system number 1 is the ATP phosphocreatine system, in which no oxygen is used. You get ATP stored in the muscle and phosphocreatine stored in the muscles and cells, and the ATP is immediately available for about 10 to 12 seconds. So now you're thinking, which events last 10 to 12 seconds? Yeah, short sprints. So this is the energy system used in 60 to 100 meters. The energy system used in 60 to 100 meters is already there in your muscles. After 10 to 12 seconds, the next energy system kicks in. That's the anaerobic glycolytic system, no oxygen used. The inputs are glucose and glycogen. Glycogen is a storage form of glucose in your liver. And so through a series of enzyme reactions, ATP, again, ATP is the energy molecule or compound. ATP is produced for 10 to 120 seconds. 120 seconds equals to 2 minutes. So now you're thinking, which events are in that zone? Yep, 200, 400, 800. So once again, up to 100 meters, we're dealing with the ATP phosphocreatine system. Up to 248, another system kicks in, which means that you must have your glucose, your glycogen and glucose levels adequate. Glucose comes from the digestion of fats, or you could consume glucose directly, but that's not recommended, because when you consume glucose directly, the body will produce insulin from the pancreas and try to convert it back into glycogen, okay? So that's why we say that starch is carbohydrate is the #1 energy source of the body. By the way, starch is actually a number of glucose molecules in a chain, you know. So enzymes in the body like amylase break down starch into glucose. That's what it is. The third system is the aerobic glycolysis. Now we're using oxygen. The first 2, there was no oxygen. Now we're using oxygen. 1 molecule of glucose can produce 38 molecules of ATP. So you're getting more energy out of this one now. And this lasts 2 to 3 minutes of moderate exercise, of moderate intensity exercise. So the junior and senior athletes, 8, 15, 100 meters will be using this. Some of the youth athletes, some of the grade 12 grade 6 athletes might be using this, but definitely not the 6 and 7-year-olds. So the final system is the beta oxidative system. This one uses fatty acids, oxygen and fatty acids. Now look at that. One molecule of that fat compound will give you 360 molecules of ATP, as opposed to, see, this one, oxygen and glucose gives you 38. This one, oxygen and that fatty molecule gives you 460, which means that you get a lot more energy out of fat. This one kicks in after 2 to 3 minutes. So it dominates in the 1500 all the way up to steeplechase, marathon, triathlon, Ironman. Your youth athletes will not be using this because they're not doing 15. Youth athletes are not doing 1500. Let me say that again. Youth athletes are not doing 1500. So, AgianSprints.com, I put this in your handout. A very interesting slide, table, which shows 100 meters, half of the time is dominated by the ATP PCR and the second half by the glycolytic. So 100 meters is about no oxygen energy systems. 50-50. 200, you start getting some involvement of the oxidative, but you notice the 200, you start pushing a little bit more over into the glycolytic and then some of the oxidative. 400, a little bit more oxidative. 800, going all the way. 1500 meters has just a couple of milliseconds of ATP PCR. Most of it is somewhere between here. 10,000 meters is almost all over here. Long jump, high jump, shot put, discus, all the throws, those are power events. Those are ATP PCR energy system events. Here's a graphical representation. On your mark, get set, go, pow! 0 to 10 seconds, that's your immediate energy system, your ATP PCR system. At about 10 seconds, the short-term energy system, that's your anaerobic glycolytic system, also known as your lactic acid system, start kicking in. And then from about 60 seconds, 2 minutes, the oxidative ones kick in. What's the point, doctor? You have to know energy systems, and you have to train the athletes accordingly. It makes no sense training an 800-meter athlete like a 100-meter athlete, because 800 meters uses slightly different energy systems than the 100 meters. Well, it makes no sense putting a Toyota part in a Honda. I'm going to stop there and take a break. I know I laid a lot of physics, chemistry, and biochemistry on you. What took me 18 years to learn, I just did it 18 minutes. Can I get a round of applause, please? No, I was just joking. If you want, I can proceed now to food and water, and then we have a general plenary. Let's go. You compete today on yesterday's food and today's water. I didn't make that up. I found that somewhere. Some bright person told me that. I don't remember who, so that's why I put it in italics. When you see something in italics, it means I didn't make it up. I could take credit for it, but no, that's not the way it is done. You compete today on yesterday's food. In fact, those of you who know football, you compete today on food from 3-4 days ago, because you have to keep your muscle stores of energy topped up. But today's water. So coaches, parents, athletes should know, especially junior and senior athletes must know why they're eating what to eat, when, how much, and who not to eat from. So here are the basics. Carbohydrate, those are the number one dose. Carbohydrate food group is the number one energy source in human beings. The secondary source is fat, meaning when your carbohydrates are exhausted, the fat kicks in, if it kicks in. If it doesn't kick in, it's called hitting the wall. And you can see when the athletes hit the wall, right? It's gonna hit the wall, I can't go no more. Red Cross. Okay. Protein is a minor source. If you're using protein for energy, it means that you are in starvation conditions. You start to lose weight. You know how you've seen some pictures of starving children. Vitamins and minerals are micronutrients. They aid in the processing of food. Micro means small. So this notion that you need mega vitamins is absolutely false for youth athletes, for junior athletes, at senior athletes, and people who are into bodybuilding, weightlifting. Because of some breakdown products from the muscles, you might get into the mega. But in children, adolescents, no. No mega, nothing. All right, we're going to get back to that. So carbohydrate is starch plus sugar. You have 4 types of sugar: cane, fruit, milk. This is just revision, isn't it? All right. Protein is for the development of cells and tissues. Fat is very important for the manufacture of hormones and also for the insulation of cells, of nerves. Nerves are your electric line coming from the power station. Power station, brain, spinal cord, and the nerves are the electric lines. And they have to be protected. Water for the transport of nutrients, hormone cells, and for cooling. Vitamins and minerals, we just went through that. Fiber for the regular elimination of stool without straining. Do you know that there are people in St. Kitts and Nevis who don't pass stool for 1, 2, 3, 4 weeks? Anybody knows anybody like that here? Yeah, don't pass this stool for 1, 2, 3, 4 weeks. They need a medical intervention, please. Please. Fiber. So carbohydrate. So I have parents from Nevis and parents from St. Kitts telling me that this is poor people food. So after I calm down, I tell them, well, boy, he making a lot of money from poor people food. No, that's but somebody has stolen it, right? All right? And so they're not eating poor people food, they're eating cornflakes. And then they want their children to perform well in their studies and in sports. Will not happen. That's it right there. Ground provisions. The Rastafarians have it right. You go from mama's breast to mama earth. From mama to mama. So Rastafarian told me that about 3-4 months ago. I was at a session dealing with breast cancer. And when he mentioned that, I took out my pen and wrote it down. Wisdom. We are what we eat. Hospitals are filling up with people who are not eating properly because it's the style. Yeah. From mama to mama earth. Point. All that is necessary for life has already been created by Jah. Scientists cannot create any food. What we are creating is food, not food. Iron, calcium, and vitamins come out of the soil. But if you want to show off that you have money, then you could buy these things from the supermarket or the drugstore. But all of these things are in nature. Vitamins are in the food. But some people have lost the ability to cook. Do we have anybody like that inside here? They just do shake and bake or add water. You put a breadfruit. You put a breadfruit in front of some people in Nevis, they wouldn't recognize it. True or false? Some people. Can I get one person who agrees with me? You put a breadfruit in front of some people, they wouldn't recognize it. You don't agree with me? Okay, good. That's good. Very, very good. Okay, you put a yam in front of some people, they wouldn't recognize it. Oh, well, what's the difference between yam and breadfruit? Come on. What's the best diet for St. Kitts and Nevis people? 3 meals per day. The first meal is to break the fast. Yeah, Doc, I don't eat breakfast, you know. And some kind of status symbol. And so the acid is building up in their stomach and doing whatever it has to do. You have to break the fast. So breakfast like a king or queen, lunch like a prince or princess, and your last meal must be like a pauper. You're coming downhill. But the system has been disturbed by persons who put profit over health. And so people are starting with no breakfast, a big, big lunch, followed by itis of the Negro, and then and then 3/4 of the food goes back in the toilet because it's not being digested properly. And some people spend an hour trying to pass one piece. Start with prayer and water. Some people start their meals with fruits. First time I heard that was from Kevin Peterson. I was somewhere and I heard, I overheard something. I said, I should try that. I should try it. Start off with a fruit because every fruit has water. Eat what is in season. If you find that certain fruits are in the supermarket all year round, there's a manipulation going on. Let's go. Healthy plate rules. Think of your plate as a clock. So from 12 o'clock to 6 o'clock, that's your local stuff, steamed or raw. Broccoli, cabbage, lettuce, tomato, cucumber. Yeah, that's a lot of fiber in there, isn't it? Yeah, you'll never get constipated. From 6 o'clock to 8 o'clock is your protein. You see that quantity there? The amount of meat, fish, chicken, monkey meat you eat should fit in the... yeah, you could laugh, okay? Laughter is good medicine. It should fit in the palm of your hand. But have you been to a wedding reception to see how people pack up their plate with I'm going to eat them down now, boy. First layer, chicken. Second layer, ribs. Third layer, chicken again. All of that is just putting extra weight on your kidneys. And then from 8 o'clock to 12 o'clock, that's your starchy food, your provisions. That's your energy food right there. But here's the manipulation. This is the American dinner plate. Protein. Well, they're right, because they produce a lot of protein, so they want to make some money from it. This is how it's supposed to be. This is the African healthy plate. Rainforest Africa healthy plate. Timing of meals. The meat starts at 2 o'clock. When should the football event starts at 2 o'clock? When should your last meal be? Well, it takes about 3 to 4 hours for food to exit the stomach. There you go. Last major meal, 3 to 4 hours before the event. No beans. Why no beans? Because beans tend to produce an extra amount of gas, right? And the last thing you want is to get a stitch. Or have a big burp, and when you burp, some of the food comes back up. No fat, because fat takes longer to digest. So we're talking about fruits, veg, provisions. No sodas, because a soda, you know what a soda is? Gas in swank. That's what a soda is. Gas in swank. All right. During the exercise, during the school meet, during the interprimary, during the football game, you want to keep the blood glucose steady because glucose is a source of energy. How do you do that? Fruits, fruit juices, watermelon. Watermelon gives you both water, minerals, and some fruit sugar. Coconut water. Yeah. Keeping things normal. In high intensity games like American football, sports drinks. After the exercise, after day number 1 of the high school championships, after the football game, you want to replenish. Because in high school championships, you have day number 2, the next day. So you want to replenish. So no hanging around, scrape them up, back to the camp, meal, food, not food, food. But on your way there, they could be drinking something to start the replenishment. No hanging around. Those of you who are involved in the management of TDC inter-school championship teams and stuff like that, no hanging around. Last event, scrape up, go. Are you making a call to the kitchen? Food ready? No. Get the food ready, otherwise contract. Otherwise I call my lawyer. Who not to eat from? Do you know anybody who could win medals from a toilet? One of the ways, if you have a championship team, right? And I want your championship team to lose, I will find a way to cook for you. And make sure that I do some potato salad, 4 o'clock in the morning with some mayo, and leave it out. So by the time you eat it at 12, that's right, she's already rubbing her stomach. You'll be on the toilet by 2. Hot food must be served and consumed hot. Cold items must be served and consumed cold. Do not make any shortcuts with this. Avoid mayo and salad dressing and ketchup. Leave those out of your athletic diet the day before the event, 2 days before the event, and during the event. So we have 2 types of food now in Nevis: food from trees and food from factory. Factory. It sounds like factory, right? And unfortunately, this type of food is dominating. That does not look like some stool on a bed of worms. Why are we eating stuff manufactured in 2021? Check the cans in the supermarket. Date of manufacture, 2021. Rusty. But they're cheap. Easy to eat. People eat this stuff straight from the can. Just like Vienna sausage. We have some work to do with the mentality. that there are no shortcuts to glory. This is hospital and make doctor richer food. People are not big bones, people are fat. This is the picture on the internet, so it's open source. There are folks like this in Nevis. Grandparents fat, parents fat, child fat, and the child baby fat. Child baby? Child baby, that's statutory rape, isn't it? Child baby, statutory rape. Let's go to hydration. Best sports drinks, we already started covering that. If you have a championship team and I want to beat you, I will fix your drink. Because no matter how top you are, highly trained you are, you cannot compete if you have cramps or stitch. So that's how to beat some people. Fix their food and fix their drink. Get into the cafeteria while they're sleeping. I'm giving you some hints. The hint is top security of the children in your camp and top security of your cafeteria. You know, security of the children because we have pedophiles, right? Huh? Yeah, man. And top security of the food because you have smart people like me telling people how to fix you. Water is the best sports drink, followed by coconut water. Nothing else comes close. Teach your children and their parents to look at their urine. How many of you, when you go to the bathroom, the restroom, look at your urine? Oh, okay. Smell the urine. How many of you, after you get up off the throne, look back to see what you have deposited in the bank? Now we get in. Yeah. A lot of people don't do that. What is coming outside, what is coming from inside, gives us a lot of. Yeah, I know. It's pee-pee and it's tutu. Yeah. But it's a message. And if your doctor is a doctor, your doctor will pay attention to what is coming out of your body and what is going in. So, check the urine color. If it's very light or clear, your state of hydration is okay. Your state of hydration starts looking like that yellow there, you're dehydrated. If you're dehydrated, they will not compete at top performance. Not. Reddish brown is a medical emergency class 1. No waiting, straight to dialysis. Your kidneys shutting down. Without dialysis, people are dead in several days. These do not require any sophisticated lab, just your eyes. When the children are telling you they have cramp, they have a cramp. Means they've lost about 2% of their body weight as sweat. Suck it up. What kind of man you be? A boy? Well, he's a boy, not a man. Some hydration tips. As much as these hydration tips have to be practiced on the training ground, not when you get to the athletic track. Up to about an hour before, they're drinking, could you lift that bottle up, please? Yeah, yeah. You want them to be consuming. Must always have a water bottle in their possession. After the event, if you want to be really scientific, weigh the athletes before and after the event to see how much water they have lost as sweat. For every kilogram loss, you have to replace 1 liter of water. If you want to be very, very specific. All of that is in the notes. So, water loss is enhanced by training during the hot weather, high humidity conditions. For those of you who are looking after senior athletes, alcohol is a diuretic. These protein powder supplements, they're too concentrated. The body has to get rid of it, gets rid of it as water, with water. And as you know, those of you who travel in airline cabins are very drying. You have to keep drinking. Finally, injury management tips. Most common injuries are muscle strains, hamstrings, calf, and for throwers, deltoid. Tennis players, muscles around the elbow. So you strain a muscle and you sprain a ligament. And so the difference, see, muscle, tendon into bone. And here's an example of a tear. Ligaments are like hurricane straps. You know those hurricane straps to keep your members to the wall? Right? If your muscle is weak, the joints take the force and those ligaments snap. How can you tell the difference? A sprain, coach, it feels loose. It feels loose. Sudden onset pain, and you might even see some. If the athlete is light-skinned, you might see purple, which means blood. And with the strain, there will be a swelling and difficulty performing. You know the athlete is capable of doing some stretches and can't do it. You know that there's a strain. Might even be some muscle spasm. You can't. You used to be able to do a good follow through on the cricket. Yeah, a good follow through. No, you can't follow through. Strain. What's the number one way? It's prevention. Prevention is better and cheaper than cure. Number one prevention, proper preparation. A good work to rest ratio. All of this is revision. Warm up, cool down. Warm up, cool down. After the day's work, cool down, stretch, and then nutrition and hydration. On-field first aid. All coaches must have something in their bag. The first bag is in your brain. Think rice. Rest, ice, compression, elevation. Can't go wrong. Come on. Give me one more lap. Stop. Ice. Compression. Elevation. The difference between a 2-week sprain and a 2-month sprain is rice. The immediate on-field first aid done properly. And then persons like Nurse Brooks and myself might be around and to tell you, which anti-inflammatory medication to use. Ibuprofen must always be taken with food. So, we talked about some training techniques. We talked about how the body uses energy, produces energy for the different events. It has to be specific. You train a 10,000 meter runner differently than you train a 100 meter runner. We talked about the best diet for St. Kitts and Nevis people, which is mama to mama. We talked about the best, well, Nurse Brooks talked about the best sports drinks, water and coconut water. Has coconut water expired from the Nevis landscape yet? And we talked about some on-stream tips. So we're ready for some Q&A. Thank you for your attention. By the way, this was said many, many, many centuries ago, that food is medicine and your medicine is your food. In other words, if your doctor's prescription does not have food, let's ask a question. Thank you very much. Let's have some questions. Microphone to go around. Well, speak. Now, friends, I only have one piece of advice. There is no such thing as a stupid question. You can get stupid answers, sometime at press conferences, but there is no such thing as a stupid question. So if you feel you want to write it down and slip me a piece of paper, please. But it must be written in standard English. Yes, ma'am. Your number. Ladies first, as usual. I bet you're from Gingerland. Oh. Turn on the mic. By the way, there's some... hold a second. You know, there are people online looking at this. This is fascinating, you know. That's why I had to make sure I put on some makeup before I came. Is it on? Yes, let's go. Yeah. If you are allergic to, let me repeat the question. If you are a sensitivity to ibuprofen, which is in the class of non-steroidal anti-inflammatories, you cannot use any in the class. So there's some other non-steroidals. I mean, one of my colleagues introduced me to, because I'm a pediatrician, I don't see 3/4 of the medications my adult colleagues use. So there's some non-steroidal ones, but we have to make sure they're appropriate for children. You understand? Paracetamol is not anti-inflammatory. Paracetamol is pain and fever relief. It is not anti-inflammatory. So that's why we have gone to NSAIDs and some others. Ice. You want a way to reduce some swelling right away? Ice. 15 minutes what we normally say, every 2 hours, keep the ice back on. Yeah. Thank you for that question. What behind you? Behind you is a gentleman who owes me 1 minute 48 seconds on the 800 meters. Close to the mic. Close to the mic.
In your presentation, it states that young children are allowed to do strength work. My question is, would you recommend a core session after a sprinting session with a child?
You do. So resistance training is allowed, but it has to be child stage development center. Start with the larger muscle groups first. Got it? Large muscle groups first, and then work your way down. So, yeah, I'll be doing some abs first. Wait, first, stretches. But first, jog around the track. Build up some heat. I'll be doing some light abs, some push-ups, all fun. You have two teams, team yam and team breadfruit, and let them come, and make it fun. I hope that answers your question.
The question specifically asking, would you do after a sprint session
No.
And the reason why I asked, you know the reason why I asked.
No. After a sprint session, no. These are pre before. Yeah. Why would you want to do? Well, anyway, yeah. Yes, sir. Yeah, it's working, but it's your voice. You have to hold it like like him. Go ahead. I'll repeat the question. Right, the research is showing that in your pre-season training, such are your gains in strength, endurance, and flexibility. And if you take some time off, it doesn't go backwards. The longer you take time off is the longer it will go backwards.
I understand that question. These kids nowadays who, during these 6 weeks, for the most part are involved in technology and just sitting back and doing nothing, as opposed to yesterday when the kids staying a little bit active. Do you think the same would apply?
You see the kind of reaction I have? I don't subscribe to these kids nowadays. No disrespect to you. Our children are under the control of adults. It's these adults nowadays. But so our purpose of having this discussion this morning is to reverse some of these nowadays thinking. With the adults who have their children plunked down in front of devices 25 hours per day. It is not working. 1 out of 3 children in St. Kitts and Nevis are fat. Reality. So that is going to increase healthcare expenditure. Sorry, that is already increasing healthcare expenditure for diabetes, arthritis, cancer, and kidney failure. We are heading in the wrong direction. So part of the motivation for having this is that sports and education have to become partners in healthcare. The children, some parents are lazy. Sorry. Some parents are lazy. They let their children have their own way and have them plunked down in front of young and the worthless. Sorry, the restless. It's not going to work, so let's work together to get this message. It's not working. It is not working. Well, I was introduced as an advisor in the Ministry of Health, so I can say that to you without fear of contradiction. It is not working. In fact, hospital expenditure is doing this. The dance is not paying for the lights. It is not working. We have too many sick people for a population of 55,000. Too many people with diabetes, hypertension, cancer. What is the what is the leading cause of death in St. Kitts and Nevis? Cancer. Next question. Yes, you have the mic? Okay, you shout and I will repeat. Go ahead. So the vegetarians need a professional dietitian intervention because they need protein. We have to make sure they get enough carbohydrates, but we have to make sure they get enough protein. A professional dietitian. Money? No. Your athlete does not eat fish? No, no animal products. No egg? So they get it from legumes, and they get the protein from legumes. Well, you know what's going to happen. They're probably going to drop off after a while. Yeah, you know what I'm saying? You have to eat. Order. You have to eat to compete. You have to eat to think. You have to eat to compete. And so if the energy levels and if the production of cells are not up to standard, they're going to drop off. Sorry to say. But there are vegetarians who are elite athletes. And they also use protein supplements and stuff like that. Protein supplements, not at the youth level, not at the junior level. At senior level, go knock yourself out. Why? These protein supplements are made for adults, not for children. You're asking a very good question. Things are made for adults and things are made for children. You could use the children things in adults, but you can't use the adult things in children. You know, we can be very dangerous. We can kill you with a stroke of a pen. Did you know that? Because it's all chemistry. It's chemistry combined with the biology and the physics. So you are asking a very good question about how we must be very specific in terms of dealing with athletes who have certain special needs. You are right. You are right. So, dietitian, please. So the question is, the child does not what?
Like eating breakfast.
Child does not like eating breakfast. That sounds like a child who does not like waking up in the morning. That sounds like a child in need who is not going to go to school. That sounds like a child who is running the house. So you asked me, the question you asked me is a very important question because as a pediatrician, I'm seeing this. Children running the house. So the treatment is for the adults, or so-called adults. I am getting a sense of some of the questions you're asking me that you have some challenges with adults. So I'm going to ask you a question. Who gives you the most challenge? More challenge? The children or the adults? I know the answer. The adults. This is the reason why you stick together, you learn together, and you say the same things. We can't have one coach saying the sky is pink and another coach saying that the sky is purple. Can't. Oh, yes.
What are these children, these young children, actually, going through so many pains?
Yes.
Every single time we
Yes.
I'm just trying to get an answer. Whether something's the genes.
So the observation, if you're no longer interested in the session, please, you're free to leave if you're no longer interested in the session. So the question is, one of your colleagues has observed that he's dealing with children with a lot of pain. That may be because the children are more sedentary, meaning not as active as we were growing up. When we started to walk, we were going mountain and beach. Some parents are allowing their children to go from bed to toilet and back to the bed. Sorry, bed to the well, some children children are lying down in bed watching their devices for 24 hours. So one of the things to do if you have a child like that, refer, or just ask a simple question, how long they are sitting down or lying down watching a screen. But you're right, because I've sensed that. Yes, ma'am.
Just touching on the question that he asked, could it be the case that some coaches it's a bit movie attacking her? Could it be the case that some coaches in your presentation I saw you highlighted where preschoolers, kindergarten and grade 1 children should not be should be just having fun. Could it be that at that age, coaches some of the coaches might have put in too much work in those children at a young age? So by the time they reach grade 4, grade 5, then they're suffering a lot of different illnesses and injuries. Would that be the case?
Yes. Yes, I've been attending the Mini Olympics since before most of you in this room were born. I'm putting grants on them now, right? Yeah. It has gotten very intense, folks. Too intense. You may, from time to time, Johnny and colleagues in the Ministry of Education invite me to do some commentary. You may have heard me make some statements. It's too intense. The priorities of 2-day event, not a 1-day event. Some children are doing too many events in a short period of time with no rest. And this discussion has been taking place since we were at Grove Park. And nothing much has changed in the terms of youth-centeredness. Unfortunately, well, I think that it is your coaching organization. If you don't have one, you have to weigh in heavily on this, because those of us in the medical community can't be the only ones talking about the overwork, I heard the statement from my good friend of the leader of the opposition. See, we could have some fun because we know each other. If you feel inferior, I'm getting this now from a lady called Eleanor Roosevelt, who was the wife of the US president. Nobody can make you feel inferior except with your own permission. It is time in St. Kitts and Nevis for people to organize, for them to have effect. If you're not organized, if you're not on the table, you'll be on the menu. Some people say they heard that first from Dr. Druno. We got that from Al Capone. Who's Al Capone? One of America's biggest gangsters back in the 1920s, 30s. If you are not at the table, you are on the menu. Get organized. Yes. My friend here. Pass? Okay. That means Gingerland is doing well. Cross country is a grass event. The younger they are, the younger they are, the more the grass. Because running on a hard surface, look it up, ground reaction forces, you come down, for every, you thought you'll get away from chemistry. Let's go. For every action, there's an equal and opposite reaction. So, boom, I have it here. So, that bounding exercise, boom, there's going to be a force back up into the body. If you do this on sand, the sand would absorb it. If you do this on grass, the grass would absorb most. If you do this on the Mondo surface, depends on the way the technology used, the thickness of it will absorb. If you do that on concrete, it's going right back up. The first major joint to take the reaction force will be the ankle. Then the knees, because your knee follows your ankle and your hip follows your knee. So it will be this way, back up. And yes, before the children get to grade 3, participating in track and field will not be fun, but painful. And this is not about pain. This is what we're doing, what we're talking about here is keeping the youngsters in the sport for as long as possible so that they can stay healthy and not be at risk for lower back strain. Look at that curvature. That rack, how many pounds that's up there? That looks like a 50 and a 50? Or maybe a 75 and a 75? Wow. We in St. Kitts and Nevis have stayed away from putting our junior athletes through this type of stress. But it is clear that other countries, their junior athletes are undergoing this kind of stress. Notice I say stress. Some people will say training, but I'm saying stress. Yeah? It's a fine line. Pressure makes a diamond and pressure can break a pipe. But we also notice that some countries, the athletes fall off before they reach 18. So be very careful. Not everything on TV is a diamond. Yes, ma'am.
What age do you recommend putting child in? I mean, sometimes
Let me see if I can translate that into English for those persons listening. You have observed some primary school children their resistance object, where is it? I have it somewhere, right? Anyway, their resistance object is not their body weight. It's not a simple barbell, a piece of board, but a tractor tire tied to a rope, and they're pulling it in an attempt. So if they're pulling, this is an attempt to build some groin strength and some hams and some quadriceps strength and some calf strength. And you're saying that these children are in kindergarten?
No.
What age?
No, question.
What age?
Do you recommend?
No. So what age did you see that?
A primary school child.
What age?
I can't really check because some of them from 12 and 10.
A 12-year-old, just a minute. See, your question, So grades 2, 3, grades 2 to 6, this is the concentration, body weight, right? There are some grade 6 children who are here in their development. So this is a boy who already has some testosterone in circulation, who already has some adolescent levels of testosterone in circulation, because compared to stage 2, the testicle is longer, the penis is longer, and he has hair. So we can tell that his levels of testosterone, which is a strength hormone, are increasing. So, yeah, if you ask me, I would say, well, let's see what he has. Drop your pants.
No, coach.
And then, sorry?
No, coach.
I said, if you ask me, because you asked me. I'll drop, and I'll say, okay, let's try a Volkswagen tire. Not a Caterpillar tire. But you could start, and as they get stronger, but at this stage, you could start loading them up, but under supervision. Drop their pants, take them inside, and take off the top. See what they are, see where they are. Stage 3. Stage 3. Again, it's going to be very important for there to be an organized approach to the training. So let's make a commitment that at next year's presentation, your question, which is a good question, but at next year's presentation, that your question wouldn't come up where a coach is apparently using inappropriate techniques. So let's go forward. Yes?
10% of the body weight, so the weight that you would put.
So what's the question? I didn't get it.
I was just saying, why do you say 10% of your body weight to the weight that you would put? For the child to have the child who certain injuries or anything on the side.
So in other words,
If it's 100 pounds down and you want to put the child to use a pull down or a tire or so on, that tire should be
okay.
10 pounds.
So you're asking about what should be the starting load. Let's deal with that question. What should be the starting load of a child who is 100 pounds? That child is probably in grade 6. Although I've seen some grade 6s at 140, 150. So you use the concept of, thank you for that question, Coach. I kind of skipped over it, but it's in the notes. You use the competition of repetition maximum. What is the heaviest load that 100-pound child can lift once? If that heavy load is 30 pounds, you back off to 15 and you work your way up. Thank you for that question. So that's the concept of repetition maximum. Everything must be determined by scientific measurement. Thank you for that question. So the concept of repetition maximum must be in the coaching manual. I'm making a strong recommendation for a coaching manual if none exists. Folks, the Australian government, the Australian colleagues have been very keen to help us. So if you need some external assistance on this, Mr. Claxton knows who to ask. I just told him. Yes?
Mr. Martin, one other way can you detect if a child is ready for a certain level of training? You remember you showed the diagram, right? But realistically, in a course, one tell your child to have their pants, so how would you detect if a child is ready?
Realistically, that's what we have to do. Okay. No. You are asking a fundamental question about selection of coaches. Isn't that correct? Okay, so I'm interpreting your question in a bigger sense. Nobody should be in front of people's children unless they are of demonstrated ability. Yes, because we are a growing nation, we have made certain decisions, but we have reached to the point now where in education, in nursing, nurses must have a bachelor's degree. We are, in my estimation, have to accelerate to the point where all teachers have a bachelor's degree. And not any only bachelor's degree, a bachelor's degree that they really learn something. So we are closing in on the point where coaches have to be qualified, which means that they went through a period of rigorous certification by a reputable organization. We are getting there. Because you see, your question is a boss question. In order for us to continue to move upwards, we have to follow the best practices. All coaches must have an understanding of the physical and psychosocial uniqueness of youth. Examined. They must pass an examination. We're getting there. Principles. We're getting there. So in order to understand the youth resistance training principles, coaches have to have a basic understanding of physics, chemistry, and biology. We are getting there. Otherwise, we are not getting there. I remember, see some of you, I can see some of you, I remember, Claxton will tell you, you look around Grove Park, remember Grove Park, into primary, 1 or 2 coaches. One of them being Eddie. Now I look in this room, and it's almost, so the salary for coaching has gone up 350. So the budget for salaries has gone up. And so, don't worry, he's a good friend of mine. He's a good friend of mine. I always buy him a malt at Culturama. A malt. That's between us, right? That's between us. But the point is, the investment from the public purse in your pay has now to be matched with certificate. That's the point. Yes, ma'am. It's 12 o'clock. The boats will wait for me. Don't worry about the boats. They will wait for me. Can I get a round of applause for that leading intervention? And to recognize my colleague. Is that not perhaps behind the mask? Yeah, okay. With the assistant patron, I saw somebody looking like her. You met that? Oh, okay. And Permanent Secretary Barrett is here. When he says jump, I say how high. Once again, let me go to the podium. Once again, the success of this experiment largely depended on you showing up and asking brilliant questions. Red Cross facilitated, Ministry of Sports facilitated, Ministry of Education facilitated. Whatever differences you have, let's go forward with networking. I am just a planter of seeds because that is the profession I'm in. If I appear to be bright, it's because I'm standing on the shoulders of giants who taught me. I went to preschool here in Nevis. I went to that, there was a junior school right up the road there in that church. That's the Methodist church? Yeah, there was a junior school in there. One day I was trying to sprint and I fell and hit my forehead against one of those walls and the mark is still here. So I have blood. I have skin in the game. So the greatest threat to a democracy is an ill-informed people. Learn that from Mandela and other persons. It's about the education. Just last week, Saturday, 28th of January, we celebrated the 88th anniversary of the Bucklands Uprising. People, 3 shot dead, 11 injured by gunshot for protesting against the social conditions that existed in St. Kitts Nevis and other places. Always remember that people died so that we could have comprehensive education. Now we have children and grandchildren of cane cutters and cotton pickers all over the world go to university and come back. So the progress we have made is due to education, not citizenship by investment. Education. So we have some more progress to make now with sports. I wonder if you get the point. St. Kitts and Nevis is regarded as a team to look at, whenever we show up, Even if we show up at Carifta games with one person, like an Adrian Williams, people still look, okay, let me see what he has. We have a track record. Even with Joaquin Collins, Clem Hicks was the first one to win medals at the Southern Games in Trinidad in the 1960s. Beat everybody in the Caribbean. Clem Hicks. Right? You know about Winnett, Barry, Arlington, Williams, and the like in cricket. He is really hit the ground running cricket. St. Kitts was a more football, track and field, but he was a scholar. Now St. Kitts has produced a young lady on the West Indies. That's all good. We have to work on netball, right? We have to work on netball, right? We have to work on netball, right? We have to work on netball.
Yes.
Yeah. Yeah. Listen, I'm going to invite you to lunch. But it will be more. It will be more.
May I have a suggestion?
Okay, so thank you for coming. And so after this, you'll turn on the mics and then we have some real suggestions. So thank you. Give us a round of applause.
Okay, good morning, good afternoon, everybody. I want to take this opportunity on behalf of the Ministry of Education, Sports, and other participants to thank Dr. Martin for facilitating the session this morning. I apologize for being late, but I assume it was a very informative session and that our participants here this morning would have gathered a lot of information which they will utilize in the preparation of their athletes for the upcoming meet. I want to give Dr. Martin a round of applause for his presentation. Also want to thank Roxanne and the other members of the Nevis Red Cross for coordinating this whole session. It was a timely and very important one, and so I know that we will benefit greatly from this collaboration, and so can you please give the Red Cross a round of applause. And to you, the participants, I hope that you utilize the information that you have gotten here this morning. A lot of times we go to sessions, we take the information, but we don't impart it or we don't integrate it into our routine. And so I'm hoping that whatever information you got this morning, whatever bit you want to hang on to, please utilize it in your day-to-day preparations of your athlete. So once again, thank to the organizers, the facilitator, and to you, the participants.